MSW degree and a MSED in elementary education, and is involved in many, many programs supporting our youth. Thank you, Cora, for being here today.
Thank you, Susan. Thank you, Congresswoman Nita Lowey, who is our champion on so many issues, and it's great to be with you today. People have said a lot of things so far, so I don't want to repeat it all, but let's get down to our county. There are 9 million children across the country, but how many in Westchester? Everybody thinks Westchester is such a well-to-do, you know, everybody's fine. So nearly 37% of children in Westchester receive their health care because of either Medicaid or CHIP. And you have to think of them together because one is really an expansion of the other. That's a lot. That's almost 40%. I mean, there's 3 people here, more than one of them is dependent on this. So what does that mean? We know about well child visits. We talked about some of the very high-end needs, liver transplants and things like that, but every day, kids need their immunizations. They need their well baby visits. They need to be able to get their sports physicals. They need all the things that our children take for granted. Every child needs that. These are the basic building blocks of a healthy, productive life, as has been said. We are ripping that away by not having CHIP. 10 years ago, our organization was at the forefront, working with the County Department of Health, the County Department of Social Services, the Child Care Council, Open Door, the other family health centers, to make sure that kids got enrolled in that expanded Medicaid and CHIP. We were so successful, we were so excited. I can't believe that 10 years later, we are back here fighting the same fight. This is unconscionable. It's ridiculous. Everyone in Congress knows, if they could take a minute and think about it, this is the best investment. It is the biggest bang for the buck that you could possibly get. Yes, most Medicaid recipients are children, but they are the cheapest Medicaid recipients. They don't cost much to keep them healthy. This is one of the most ridiculous things. I really can't believe that I'm here 10 years later having this same conversation. Everyone knows what should happen. We've got to make a lot of noise. We've got to stomp our feet, as someone said. That's the best thing we can do to make sure that this ridiculously simple problem is fixed as quickly as possible, so that millions of children and thousands in our own county, 87,000 about, right here in Westchester, are not left without coverage that they so desperately need and their families count on.